Well, as I mentioned earlier, the next two levels of regenerative biologics would be stem cells and stem cell signals called extracellular vesicles.
Hmm.
Mostly what we do now is extracellular vesicles for this reason. Stem cells, if you have them delivered to your body, let's say you have an IV stem cells for various reasons, those stem cells will probably last in your body 10 to 14 days, if that. Yet the benefits go on for weeks and months thereafter. So why is that, right? And this has been studied, and it is clear that the stem cell delivery to your body is actually causing cell communication to your cells, helping to slow the inflammation, activate your stem cells and your cells to function more youthfully. And that signal is through these small communication bubbles called extracellular vesicles. Now, cells themselves are small, but these extracellular vesicles are 1,000 times smaller. So we call them nanoparticles sometimes, but for short, we call them exosomes. And exosomes have many advantages over stem cells. And really, they are doing the work that stem cells would be doing anyway. So we've skipped now over stem cells and go right to, in many cases, these exosomes. That doesn't mean there's anything wrong with stem cells, and they're used successfully, throughout the world. But I'm skipping over the delivery mechanism, going right to the business end of regenerative medicine. And when I entered regenerative medicine, when I made that early transition, I wanted to pick the most efficient source. So the beauty of these exosomes are, and for we call them exosomes for short. They're stem cell derived exosomes. But the beauty of them is they're abundant. They travel very well in the body. For example, they cross the blood-brain barrier into the nervous system if they're given IV, where stem cells really don't. They're too large. They're much less costly than stem cells, less than half the price for the same kind of effective dose. And we can give even more concentrated doses because the main source is from donated amniotic fluid.